Supplies needed for this procedure are a CVL dressing kit, clean gloves, normal saline flushes, clave adapter, non-coring or Huber needle, and a biopatch if indicated by your facility policy. Verify your order, gather equipment, introduce yourself, provide privacy, identify your patient using 2 patient identifiers and confirm allergies, provide any needed education, perform hand hygiene, and adjust the bed to a working height. Don clean gloves and expose your patient's chest. Assess the port area for redness, warmth, drainage, tenderness, pain. Apply a mask. In addition, apply a mask to your patient and instruct them to turn their head to the opposite side of the port. Open your sterile kit according to aseptic technique. Open your non-coring needle aseptically and place on your sterile field. If using a biopatch, open it, place it on your sterile field. Do the same with your clave adapter or your clave adapters. And lastly, open your flush and place it on your sterile field, being careful not to touch the flush while dropping it on the sterile field. Once all items are ready on your sterile field, you may don your sterile gloves. Once your hands are sterile, open your normal saline flush and attach it to either the end of your Huber needle if a clave is already attached, or to the clave and then attach the end of the Huber needle adapter to the clave. Prime the tubing and the Huber needle with your sterile saline. You may place it back on the sterile field and prepare to clean your client's chest. One alternate way of attaching your flush to your non-coring or Huber needle and clave adapter is to leave the flush placed aside from the sterile field. Once your gloves are donned sterilely, you can connect the clave adapter to your non-coring or Huber needle and then choose your non-dominant hand to pick up and uncap the flush. You will then attach the flush to the clave adapter that is now attached to your non-coring or Huber needle. Once the flush is attached, you may lift up the entire device and prime it over your sterile glove package or the trash can, being careful not to lower it below your waist. You may then place the non-coring needle back into your sterile field because it has only been touched with your sterile hand. Set the flush back onto your bedside table. For the most immaculate way to do this procedure, note that in this still image, in addition to the supplies listed before, we have a 10 cc sterile syringe, a sterile needle, and a 30 milliliter vial of normal saline. Once the kit is open, remove an alcohol swab, remove the cap to your sterile normal saline, and clean the valve. While that is air drying, go ahead and open up your non-coring or Huber needle and drop into your sterile field, and do the same with your clave adapter, your needle, and your 10 milliliter sterile syringe. Once all your items are prepared in your sterile field, don your sterile gloves. Once your sterile gloves are on, assemble your needle to your syringe and draw up 10 milliliters of air. Utilizing assistant to aseptically hold your vial for you, access the vial with the needle, inject the air, and have your assistant help by inverting the vial. Draw up your 10 milliliters of flush, and be careful not to touch any of the vial or your assistant's hands with your sterile gloves. Remove the needle from the sterile flush that you have now created, attach your clave adapter to that, and attach your clave adapter to the other end of the clave adapter to your non-coring or Huber needle. Lift it off the sterile field, and then utilize either the trash can or another area to prime your needle. Then you may now place the entire thing back down into your sterile field. All three ways have potential for error. Being able to identify any potential sterile breaks that are unnecessary will warrant less complications for your patient. Clean the intended area for insertion with chlorhexidine in a back and forth motion using friction for at least 30 seconds. Then allow this to air dry. Once dry, use your non-dominant hand to stabilize the port and pull the skin taut between your index finger and your thumb. Using aseptic technique with your dominant hand, insert the primed needle into the center of the port at a 90-degree angle. Push firmly through the skin until the needle hits the back of the port. To confirm correct placement, pull back on the plunger of your saline flush and you'll get a brisk return of blood. After blood is confirmed, use the push-pause method to flush the port. Inject 1 to 2 milliliters of normal saline and pause, and repeat until 9 milliliters have been injected. If you're using a negative pressure cap, clamp while instilling the last 1 ml of normal saline while clamping the extension tubing. Remember, if you do not obtain blood return, do not flush the port. Using aseptic technique, apply transparent dressing, label per facility policy, and remember that the dressing should be changed every week or as needed when soiled, damp, or loose. The non-coring or Huber needle must be changed every week or per facility policy. Once complete, cleanse your area, disposing of materials, remove your gloves, and perform hand hygiene. For deaccessing an implanted port, the process is fairly simple. Perform hand hygiene, apply clean gloves, and make sure the patient is in the least turning their head away from the insertion site. Assess for redness, swelling, or discomfort. Assemble any needed supplies, which should include alcohol swabs for cleaning, 0.9% normal saline flush, as well as a sterile gauze and tape. Open the clamp on your extension tubing, cleanse the end of the cap, with an antiseptic and do not let go of the hub on the extension tubing. Allow it to dry. Connect your saline syringe, aspirate for blood return, and flush the line per facility policy. While stabilizing the needle, remove the transparent dressing. Using the thumb and index finger of your non-dominant hand, stabilize the port. With your dominant hand, remove the Huber needle with an upward pull. Assess for discharge or drainage from the insertion site. Use a sterile gauze to apply pressure to the site if bleeding occurs. Once hemostasis has been achieved, if needed, you may apply a tape strip to your sterile gauze and recover your patient's chest. Dispose of your supplies, remove your gloves, and perform hand hygiene. Ensure that your patient is comfortable and safe, and then document the procedure, including the assessment of site, patient's response to procedure, and education provided.